Magazines to size zero actresses on TV and movies. Young women and teen girls have some impossible standards to live up to in our country. Do we live in a culture obsessed with sex? We'll find out tonight on Voice of Reason. Good evening, everyone, and welcome to Voice of Reason here on the Comcast Network. I'm Larry Kane. So the question is, I got them here. We purchased about 50 of these. You look at the newsstands, it's the same story. A culture obsessed with physical being and sex. Does that damage teen girls by sending the message that being sexy trumps intelligence and character? Or is it good? So we have to ask ourselves, what is the price of beauty? It seems everywhere we turn, we're bombarded with images of what the perfect body should be. Our celebrity-obsessed culture tells us that just about anything goes. Take a look. You only have to look as far as our TV screens and any magazine rack in our local markets to know what sex does sell. And it's extremely profitable to the glam mag publishers and advertisers who hawk their products in these publications. But at what price do our young daughters and sisters pay? Well, this obsession has gotten to the point where parents are allowing their young children to undergo the knife, opting for plastic surgery, nose reconstruction, liposuction, very desirable procedures for teen girls and boys looking to change their appearance, all to gain acceptance with their peers. Here to help answer some of those sometimes troubling questions, from New York, very proud to have Dr. Frederick Lukash, a board-certified plastic surgeon and a spokesperson for the American Society of Plastic Surgeons. Thanks for joining us. He practices in Manhattan and Manhasset, New York. This is a tough spot for you. We talked earlier, and you've talked about the gratification that young people get from the kind of surgery that they're getting today. And you're primarily a pediatric surgeon, is that correct?
Yes, I have a strong interest in pediatric and adolescent plastic surgery.
So where do we draw the line? Do you ever, if somebody comes into you and says, I want to look this way, and obviously you're very good at what you do, you're a professional, you're speaking for this organization, do you ever say, no, you really don't need it?
I say, no, you don't really need it a lot. It's, you have to find the line between the absolute reconstruction and the celebrity wannabe and the shades of gray in between, where you try to adjust to physical flaws and self-esteem and body image.
Does this change the person? Does it make that person happier all the time? Or do they find, in your experience, that they might feel empty all about it?
Well, I think you have to sort all that out. I mean, the reality is that for some people, if the psychological angst can truly be related to a physical flaw, like ears that stick out, or an asymmetrical breast, or breasts that are way too big, or a large nose and a small chin, then correcting those will very often put the person on the right path. If their motivations are completely askew, and that's our job to sort it out, then we don't want to operate on those people because we will not be treating the ultimate problem.
It's a problem, doctor. I mean, outside of the surgery issue, which is a totally different issue.
I want to address two issues because you touched on some very interesting issues. First, going back to the eating disorders, there's a whole issue of empowerment. And occasionally what I have seen is, hypothetically, there's a young girl whose breasts are very large and is suffering from self-esteem issues, catcalls, weight on the breasts, inability to participate in sports, won't go to gym class. However, for whatever reason, financially, socially, economically, parents are not in favor of a breast reduction. So the empowerment issue of the correcting of what's physically bothering her is taken out of her hands. So now what she does, she recognizes by seeing in the magazines that some of these celebrities have starved themselves into basically no breasts. Their bodies get small, their breasts get small. So now their empowerment comes from, well, I can do this. And since I can't get this done, I can do this. And so frequently we've seen that. So what I try to do in my practice is sort of at least advise the parents or try to discuss with them that there is a potential to make one problem turn into another, which could be a far worse problem.
Parents involved in this process, are they very much a part of this?
Well, they're a part of it. They're a part of it in my world. Everything is done as a group dynamic when you're dealing with the adolescent and teenage population. But one of the things that I will say, just so that what we do is not misconstrued, I mean, I look at self-esteem and body image, and the body image part of self-esteem is just one of the spokes on a wheel that's trying to be in balance and go forward.
You pointed out something in the break that I want to give you the opportunity to say. that you're not a predator, okay, and your business is not predatory, that you really are not opposed to what they're saying, that you just have a different perspective.
Well, no, I actually agree with everything that they're saying, that we're sort of at the receiving end of all that's happening in the media and the images that are presented, and where some of the things that we do may not be viewed as politically correct, they may be very emotionally correct. And I look at, like I said, body image and self-esteem as just one spoke in the wheel. And I'm not saying that we are by any means the end-all and be-all, and do never present myself or the society's self as a panacea to what ails, children and adolescents.
Well,
however,
yeah, go ahead. I'm sorry.
However, there will be some children and adolescents and teenagers that have a certain amount of psychosocial angst that can be directly related to a physical flaw, and the correction of that physical flaw will make them feel better about themselves.
Lukash, is it true, again, just pardon my naivete here, that parents are gifting children with surgery? Does that happen?
That's a term that's thrown around quite a lot, and I think what's happened there is there can be a little play on words or a little switching. In other words, in my practice, I look to do plastic surgery on teenagers and adolescents at transitional periods in their life. So it may be between middle school and high school, or between high school and college. So where I look for a transitional period so that there is a transition from one social environment to another, that I guess could be construed as a gift for graduation, but it's not really planned out that way. It's planned out as a safe transitional period to perform the surgery.
I remember
anytime there's someone with...
Doctor, I disagree with you. I remember in high school, 4 of my girlfriends said to me, for my graduation, I'm having my nose done. It was very, very clearly a graduation present.
Well, that may be how they're viewing it and the parents are viewing it, but that's not how I, as the plastic surgeon, view it. And when I counsel the patients, I'm picking the opportune times to perform the surgery for the right reasons, and I pick the time, they don't pick the time.